To bring the hearing to order. Thank you. This hearing's for the Joint Committee on Public Health. Thank you for joining us. I'm Senate Chair William Driscoll. My co-chair, Rep. Decker, will be joining us a little bit later on. During today's hearing, we'll discuss and gather testimony from legislators, advocacy groups, and coalitions, as well as members of the public regarding several bills before the Joint Committee pertaining to professional licensure, clinical laboratories, food safety, and miscellaneous public health matters that are before the committee. For those of you who might be new to this process, there won't be any decisions made today on these bills. The purpose of this hearing is to gather that testimony and input from the public. We want to know your thoughts, feelings, and perspectives before we deliberate with the committee and make any decisions. An act providing for consumer access to and the right to practice complementary and alternative healthcare services. Kiki Mompoint.
Greetings. Thank you to everyone here for holding space to speak about a very important issue. My name is Keisha Jennifer Mompoint. I'm speaking not only as a practitioner, but also as a healer and as well as someone who is receiving healing care. Just to tell you guys a short, brief story about myself and my journey. I have about 10 years of experience training doctors on wellness and how to take care of themselves. I created a co-curricular professional development and wellness program at BU School of Medicine, so I really understand the environment that doctors work under. But I also understand the power of energy and energetic health, and my own journey is that I rebranded my business, so I work in a ecosystem of healers and wellness workers, so I understand the pressures of being a small business and trying to support people in the community with health and resources that they know they can't receive at a hospital but would help support them. And financially that's a lot, but also emotionally and mentally and spiritually it is a lot. And I myself recently was diagnosed with pancreatic cancer 2 years ago, about 3 weeks after my father. And God rest his soul, my father's no longer with us. However, I'm here, I'm healthier. I've been collecting QLQT data for the past 3 years on what it took for me to heal myself spiritually, energetically, emotionally, physically, and mentally. And that's something that Western medicine doesn't have access to. And I know that with the work that I'm doing within the city and within the state with people like myself, it's really valuable to make sure that folks who are building these types of businesses don't get the burdens of having to get all the extra licensures and all these other things. And I'm a huge proponent of what I call mixing the medicines, which means we do this work in tandem with hospitals. And so being able to have folks work together to support the healing and wellness, not just in the sense of just physically, but energetically through Reiki, sound healing, as well as nutrition, is really the way that I healed myself and how I've been working to heal others. And so I'm in support of this bill, and I actually wrote it down because I was like, I'm going to forget. H2504S1481. And I think it's really beautiful and powerful that we are in a space and place now in Massachusetts where we're able to support people holistically. And I think it's really important as we see what's happening in our society, in our country, that we make sure that everyone has access and there's no things restricting it. And so I appreciate you guys. I'm very grateful, and I pray that you guys have a lovely day.
Thank you for sharing your story, testimony. Any questions? No, thank you.
Thank you.
Next, virtually, Lisa Ottaviano.
Can you hear me?
Yes, welcome.
Thank you. I'm testifying in support of Bill S1481 and H2504. I'm certain everyone in this room has had an issue that could not be resolved by conventional medicine and pharmaceutical drugs. Making Americans healthy again has been at the forefront in 2025, and alternative and complementary practitioners are a key cornerstone to making this happen. I have personally benefited from acupuncture, Reiki, massage, cranial sacral therapy, and Rolfing. When I was rear-ended and developed post-concussion syndrome, my PCP's sole advice was to avoid screen time and stay hydrated. Alternative practitioners helped give me my life back. The U.S. spends more per capita on conventional health care than any other nation, yet ranks 34th in life expectancy and performs poorly on most measures of health, such as infant mortality and chronic disease. Please vote the Broad Safe Harbor Bill out of committee favorably to protect practitioners and the consumers who rely on their services. Thank you.
Thank you. Any questions from the committee? Seeing none. John Ricci or John Ricci virtually? No. Abby Beal virtually? Abby,
Yes,
welcome.
yes, thank you. I'm here. Thank you very much. I'm here in support of Senate Bill 1481 and House Bill 2504, an act providing for consumer access to and right to practice complementary and alternative healthcare services. So thank you for having me, esteemed lawmakers here of Massachusetts. I'm Abby Beal. I'm a homeopath from Northampton, Mass. I testified in 2019, 2021, and 2023 in support of the Safe Harbor Bill, and I continue to be 100% in favor of it because our residents, including myself, deserve the ability to partake in natural and complementary healthcare practices. These natural practices in general are person-centered, holistic, gentle, and work with a person's innate ability to heal. I first became interested in natural approaches to health when my firstborn was just 9 months old. He had repeated ear infections and many doses of antibiotics, which in hindsight destroyed his precious gut microbiome. By 16 months, ear tubes were being recommended, which I understood as common practice, but as a mother, I was hoping for a more permanent and less invasive solution, and I found it through homeopathy. We visited a homeopath, and after a 90-minute interview that not only focused just on the ear infections, but also things like his behaviors, his habits, and his likes and dislikes, he was then given 3 pleasant-tasting homeopathic pellets, and his ear infections went away for good. It was a serious head-scratching moment for me, and one that launched my curiosity about homeopathic medicine. We continued treating my son with homeopathy as he would get childhood illnesses, and homeopathy would help him without antibiotics. I then became a patient of homeopathy where I personally experienced its subtle and amazing healing power. I studied homeopathy over an 11-year period and now nationally certified classical homeopath, which is a prestigiously similar to a CPA designation for accountants, so it's a lot of work that's involved in getting to this point. There is no licensure available for homeopaths, nor for most of the other alternative and complementary practitioners. So if you look, by the way, at how much I pay for professional malpractice insurance, it's under $200 a year. Insurance companies do their due diligence and obviously see how harmless this practice is. As part of my certification, I'm already required to have clients sign a disclosure describing who I am, my training, what I do, and what we will be doing together. This is the same type of disclosure required in the Safe Harbor Bill. The consumer signs off knowing what we will be doing together. Today, I'm speaking to you from the Kripalu Center of Yoga and Health in Stockbridge, where there are many talented alternative and complementary practitioners who would benefit from the passage of the Safe Harbor Bill, including Reiki practitioners, integrated energy healers, Ayurvedic health consultants, and more. It would be a blessing to allow all of us to continue practicing freely in our state, like those who already have safe harbor practice laws, as in Maine, Rhode Island, California, Nevada, New Mexico, Arizona, Louisiana, Minnesota, Oklahoma, Idaho, and Colorado. So I implore you to vote yes for this bill to ensure health freedom for our state. Thank you very much for your consideration.
Virtually Carol Bedrosian.
Yes, hello, that's me.
Welcome.
Thank you for inviting me to testify today on behalf of S1481 and H2504. In 2017, the National Institutes of Health estimated that approximately 4 in 10 people are using some form of alternative or complementary care. For the 7 million people living in Massachusetts, that's close to 3 million people. I am one of them. For over 40 years, I have chosen to use alternative medicine exclusively because I have found that it works. It's also the most affordable form of healthcare for me and widely available at a reasonable cost in this state through a well-established, long-standing network of both licensed and unlicensed professionals. The thousands, maybe even tens of thousands of unlicensed holistic healing practitioner businesses who now thrive in this state provide healthcare services to the millions of residents who rely on them in many settings, including hospitals, healing centers, private practices, and homes. The safe, non-harming healing professionals who provide these services need a legislative safe harbor that ensures they can continue to provide their healing services just as they do now, but without fear of retribution for practicing medicine without a license. This bill provides the safe harbor and, if passed, would allow Massachusetts to join 11 other states in the nation offering safe harbor to their holistic health practitioners. Protecting practitioners legally makes Massachusetts an attractive location for practitioners to set up or maintain an alternative healing practice. This allows Massachusetts residents to continue enjoying easy access to the widest selection of holistic practitioners possible at the most affordable rates. It also provides the state with oversight of unlicensed practitioners and the public with protection through the establishment of prohibited acts which practitioners must avoid. And it provides consumers with disclosures of credentialing information so they can make an informed choice about any practitioner they choose. This bill costs nothing for the state to implement and reduces healthcare costs overall by keeping people healthier longer. The more accessible holistic medicine is in the state, the happier its residents and state healthcare budget will be. Please pass this bill affirmatively out of your committee. Thank you. Carol Bedrosian.
Thank you. Any questions?
My name is Loretta Lamont, and as a mother of four, a small business owner, taxpayer, a lifelong Massachusetts resident, I'm here to strongly encourage and to support for both H2504 and S1481. As a mother, I'm ever grateful for my family being able to benefit from alternative therapies over the last 27 years. We have faced many situations where complementary and holistic modalities were crucial for healing. As a business owner, I am an EFT master trainer for both EFT International and EFT MRA. I teach EFT, which is a holistic modality where we utilize meridians and address all sorts of issues. And I teach that to therapists and to coaches, and many of my students are Massachusetts residents. And so having this protection would be incredibly valuable and important for those therapists and coaches who are utilizing this modality here in the state. But on a simpler, more practical note, I'm really just here about common sense. Holistic and alternative practitioners are helping people get closer to their natural state. In many cases, they're using modalities and wisdom that's been around for centuries or thousands of years. These modalities are less intrusive. They're overall much safer. And I personally have been in this industry since 2013. And I have to find out who the other lady was getting her insurance from, because I pay about $300 a year for my insurance. And because the risk for holistic practitioners is just that low. The people of Commonwealth have spoken time and again on how they don't want these modalities to be regulated, and they do want them to be protected. And so I'm really just here to say thank you to all of you for listening to your people and essentially for supporting what the Commonwealth is asking for, which is to not have regulated alternative and complementary therapies, and to have those people to be protected. And like they had also shared, there's other states who are utilizing this, and in this holistic modality, oftentimes we're working with people in other states. And so I think it's really important that we are able to access and work within people in different states. So again, I just want to thank you all for your consideration and for supporting H2504 and S1481. Thank you very much.
How's everyone doing?
Welcome.
Good. All right. My name is Alexa Jones, and I am here to support H2504 and S1471. I'm here for the positive reinforcement of this to support. I am an alternative healthcare practitioner who resides in the Commonwealth of Massachusetts. I am here to show strong support for S2504 and S1471, which provides the freedom to practice alternative healthcare services. This law protects entrepreneurs such as myself who are giving these services in the hopes of making the world a more peaceful place. Not only does it bring in good energy, but community to Massachusetts. With these alternative healthcare services, I've seen so many transformations in all sorts of people. There are seniors who start meditating and don't feel as scared about their future. Moms who can finally organize themselves after a life activation. Successful businessmen who cut the negative ties from work with negative energy removal. Special needs kids who have a moment of nervous system regulation with crystal healing. It helps everyone. Not only that, but clients will attend community events related to the healing after, showing just how much alternative healthcare has impacted them. It brings an element of community to Massachusetts, which is so needed in the hustle of daily life. We need each other's support in the things we are going through, instead of isolating ourselves or taking a pill or relegating it to just a room with a therapist. Yes, those are all needed, but the heart piece, the spirit, is where we truly shine. Please vote yes on H2504 and S1471. Thank you for your time and consideration of this issue.
Thank you. Thank you for your testimony. Any questions?
All right, good afternoon, Chair Driscoll, Chair Decker, and everybody else on the committee. Thank you so much for the opportunity to testify today. My name is Christine Iannata, and I'm a life activation practitioner residing in Revere, Massachusetts. I'm here today to voice strong support for S1481 and House 2504. I remember the first time that I received a life activation. It is a sacred healing modality that sheds light on what is holding you back from your life's purpose, increases motivation, and much, much more. Before receiving a life activation, I was filled with self-doubt, I lacked confidence, and was very anxious. Since the life activation, I have started my own business, I became way more confident and felt the drive to become a practitioner of this healing modality so that I could bring the light to other people's lives the same way that it brought light into my life. As a life activation practitioner, I already inform my clients that I am not a doctor or a licensed therapist, and this bill will affirm what we are already doing, operating with integrity, transparency, and respect for the public. I respectfully urge you to support these two bills so that practitioners like myself can continue serving our communities openly, safely, and transparently. S1481 and H2504 offers important legal clarity and protection for both consumers and practitioners, and I believe it reflects the values of choice, access, and well-being that Massachusetts stands for. Thank you so much.
Greta Sibley.
Thank you very much. Esteemed members of the Public Health Committee, thank you for this opportunity to speak. This is my first time participating in a hearing. I have shown up in the past to be a body counted, but have never added my voice in person. I want to express my strong support for S1481H2504. I am a practitioner, teacher, and consumer of complementary therapies in Massachusetts. I have submitted my testimony by email, and out of respect for your time, I will be brief here. I live in Western Massachusetts in the Pioneer Valley, also known as the Happy Valley. I cannot tell you exactly how many practitioners and consumers of complementary therapies are here in the Valley, but it feels like there is a practitioner on every corner. We are popular. We are sought out. By providing a safe harbor, this legislation has the potential to positively impact a great number of your constituents. While many practitioners practice in institutional settings, many of us have very small businesses. Many of us are senior citizens who had other careers when we were younger, and now we are doing what we love the most. The nature of our work is personal and highly customized, and it takes a lifetime to develop many of the skills that are essential to be an effective practitioner. We learn to listen deeply and to build the harmony present in each person. Life is stressful, and people need a great variety of resources to meet their needs. In my opinion, the legislation before you is all the regulation we need, simple common sense guidelines for practitioners. Please protect our right to practice and the consumer's right to choose. Thank you for your time and your consideration.
Thank you for your testimony. Any questions? Seeing none.
Chairs, vice chairs, honorable committee members all. Ot Pass, H 2504. My name is Clark Reddick. I am the president of Health Freedom Action Massachusetts, a 501c4 nonprofit that works to balance public safety with the rights of those practicing and consuming the healing art forms. My personal experience, I'm 55 years of age, and the Medical Model Center on Drugs and Surgery has never worked for me. As a child with allergies, I tried antihistamines that made me sick. I contracted strep throat yearly, which was incredibly painful. Antibiotics were of little use. The strep always returned. The quote cure was only a Band-Aid. As a teen, I experienced horrendous abdominal cramping. By 24, chronic fatigue. Finally, someone referred me to an unlicensed healthcare practitioner. On day one, my cramps disappeared, never to return. The method impacted the cause of my disease rather than merely treating symptoms. Far from experiencing morbid side effects, I experienced side benefits, including the complete disappearance of all allergies as well as my chronic fatigue. I've never had strep throat again. An unlicensed practitioner gave me my life back, yet he and his colleagues work in fear of the practice boards. Please fix this. Through the years, each time a health challenge came up, I continuously sought the advice and care of unlicensed practitioners who helped me solve each naturally. When in my late 30s I spiraled into major depression, I refused to see a doctor. I knew I wasn't sick because of a deficiency of Prozac in my bloodstream. I wanted a real cure, not a lifetime of drugs and their side effects. I found it, again, at the hands of an unlicensed practitioner. At 42, I changed careers and became, guess what? An unlicensed practitioner, helping many reverse debilitating conditions, sometimes very serious illness. Under CMR 201-4, medicine is defined to include the, quote, prevention, alleviation, and cure of disease. Really? Can it be called prevention if it requires drugs or surgery? Can a lifetime of prescriptions be called a cure? This cynical definition is by design. It allows anyone that helps somebody else to feel or be better naturally to be charged with the, quote, crime of practicing medicine. Because the medical lobby wants to own healing, I could arbitrarily be targeted for fines, penalties, even prison. This fear has often prevented us from reaching those that need us most. At the same time, Title 16 exempts the following: hypnotists, magnetic healers, Christian Scientists, and clairvoyants. Good Samaritans are exempt under the codification. We therefore seek equal protection under the law, please. There is no opposing testimony for 4 consecutive sessions. There is no reason to refer this bill to healthcare finance either, as there is no financial component. Please pass both to the floor for a vote as was done in 2019. 11 other states, including Rhode Island and Maine, have passed similar laws years ago. Thank you very much. If you have any questions, I'm happy to answer them.
I would like to read my late daughter-in-law's testimony from last session. This is what Janice had to say in person on September 21, 23. Dear committee members, I am here as a consumer in support of these bills. Back in late 2019, my health was compromised by COVID, making me vulnerable to autoimmunity. I developed crippling arthritis, and by that winter, my life as I knew it was over. I initially saw a rheumatologist. He prescribed a drug that was so dangerous, He said I could go blind and I would need to see an ophthalmologist every 3 months for the rest of my life. He frightened me with x-ray images of my hands and by telling me I better take the drugs or I would end up in a wheelchair. I'm here today without a wheelchair, not because I took his drugs, I assure you, but because I sought the advice and care of complementary and alternative healthcare practitioner. Using a combination of unlicensed methods, he was able to completely restore my health. My rheumatologist later admitted, "You do not need to come back. Follow your practitioner. He's doing a good job." My success was due to a unique system perfected by a practitioner, using bits and pieces of many other methods. While such an invention will never become licensed, it can be protected, and that's where I hope you come into. Regulation of natural healing may be to the dream of pharma, but it is the devil's work, obliterating creativity and innovation. Anti-competitive licensing is un-American. Safe harbor is the antidote. I feel sorry for all the unlicensed professionals that practice under the shadow of a system that has targeted many for penalties and prison time in other states. These are good people wasting their time and energy fighting a corrupt power structure. They have more important things to do, for example, helping sick people like me get well. Benjamin Rush, a founding father and signatory of the Declaration of Independence, founder of Dickinson College, professor at the University of Pennsylvania, and the father of American psychology, had this to say: "Unless we put medical freedom into the Constitution, the time will come when medicine will organize into an undercover dictatorship to restrict the art of healing to one class of men and deny equal privilege to others. The Constitution of the Republic should make a special privilege for medical freedoms as well as religious freedom." Please report H2504 and S1481 favorably. Thank you. It was from Janice Reddick.
Thank you for sharing that testimony. Thank you for being here.
Hello, and thank you, Chairs Driscoll and Decker and committee members, for allowing me the opportunity to testify today. My name is Jordan Bain, and I'm a spiritual healer and teacher with over 20 years professional experience residing and practicing in Massachusetts, also born and raised here. I'm here testifying today in support of H2504 and S1481. These are very clear, simple bills that would mirror similar legislation already enacted in 11 other states and pending in several others. These bills are a powerful and clear way to both protect consumers with mandatory practitioner disclosures that most of us already use, while ensuring ongoing consumer access to the hundreds of unlicensed fields of complementary and holistic healing being practiced by thousands of practitioners across the Commonwealth of Massachusetts. As the committee has heard over the last 7 legislative sessions since 2016 regarding the so-called bodywork bill, there have been ongoing legislative attempts to mandate licensure across these hundreds of fields of practice. I have personally testified alongside hundreds of other practitioners against those bodywork bills over the years, as well as in support of several of the safe harbor bills, due to the impossibility of monolithic licensure across these hundreds of diverse fields of practice. And for more information, you can refer back to previous hearings, and those are, I'm sure, recorded on the record. These unlicensed fields include many spiritual healing modalities, indigenous wisdom traditions from around the world, and systems of wellness that have often been proven for thousands of years, sometimes cutting-edge, non-invasive, and harmless therapies which also present no meaningful risk. For me, the access to a wide variety of these covered modalities, especially spiritual healing, has personally saved my life many times. These spiritual healings have taken me from suicidality as a teenager into a functional, healthy young adult who had a vision of his future, and then, in my late 20s, after a decade of receiving these services from many different types of practitioners, into a professional practitioner of spiritual healing myself, who has now helped thousands of people across New England and in other parts of the country as well. My travels have even taken me to volunteer and teach in other countries to teach spiritual healers there. I've been able to buy a home as a business owner and start a family, and I have seen my clients completely turn their lives around, sometimes overcoming anxiety, depression, career difficulties, health challenges, spiritual disconnections and doubts, and to discover real joy, purpose, healthy relationships, and so much more. I owe my whole life to these holistic healing modalities from many different fields of practice, which I believe should always be guaranteed to be available to the residents of Massachusetts, improving the quality of life for the approximately 40 to 50% of residents of our state who utilize these services every year. I urge you to support H2504 and S1481. Thank you so much.
Thank you for your testimony.
My name is Ann Holland, and I live in Bedford, Massachusetts, here in the Commonwealth. I'm speaking today as a Reiki practitioner and teacher, and a longtime supporter of integrative health and wellness. I'm here to voice my strong support of House Bill 2504 and Senate Bill 1481, collectively known as the Safe Harbor Practitioner Bills, legislation that is timely, reasonable, and deeply aligned with the values of public health, equity, and consumer empowerment. These bills are not about creating loopholes or avoiding standards. On the contrary, they provide clear guidance, transparency, and ethical boundaries for practitioners of complementary and alternative health services such as Reiki, meditation, breathwork, and sound therapy. Practices that are non-invasive, inherently low risk, and deeply rooted in both tradition and modern healing science. What the Safe Harbor bills do not do is impose unnecessary licensure, bureaucratic oversight, or burdensome fees on those of us working at the front lines of community wellness. And that's critical because many holistic practitioners are solo operators, caregivers, and wellness entrepreneurs, often serving populations that fall through the cracks of our traditional healthcare system. Let me be clear, there is no public health crisis stemming from complementary practices. There is no pattern of harm. What there is growing demand, a hunger for holistic support that meets people where they are, a need for healing modalities that work in harmony with and not in opposition to conventional medicine. We now have clinical studies and decades of observational evidence showing that practices like Reiki and meditation help reduce stress, lower blood pressure, ease pain, improve immune function, and support emotional resilience. These are not fringe outcomes. They are tangible public health benefits. Safe harbor protection ensure that people from all backgrounds can continue to access those services without fear, stigma, or confusion, and that practitioners can serve their communities ethically and sustainably. By passing H2504 and S1481, the Commonwealth has the opportunity to lead the nation in crafting legislation that respects both tradition and innovation, that expands access without overreach, and that strengthens public health, not only through science and medicine, but through human connection, emotional well-being, and integrative care. I urge you to pass these bills. Let us not restrict what is already working. Let us protect what is healing. Let us affirm that in Massachusetts, health is whole, body, mind, and spirit. Thank you so much.
Good afternoon, Chair Driscoll and Decker, Vice Chairs, and honorable members of the committee. My name is John Holland, and I'm a resident of the Commonwealth. I'm a trained level 2 Reiki practitioner. I have over 40 years of experience in developing and commercializing different sciences and technologies with a academic background in pre-medicine, a degree in chemistry, a graduate certificate from MIT Sloan. I want to thank you for the opportunity to voice my strong support for House Bill 2504 and Senate Bill 1481, which offer safe harbor protections for complementary and alternative health practitioners in the state of Massachusetts, or should I say the Commonwealth of Massachusetts. This is a deeply personal issue to me. On a personal level, just last week, I underwent total knee replacement surgery. As many of you may know, recovery is intense, physically, mentally, and emotionally. Reiki and the other complementary practices that I have played a powerful role in how I've managed pain, stress, and healing during this time. In the weeks before the surgery, Reiki helped me cultivate a calm, healing mindset. I entered the hospital not fearful, but centered and prepared, not just as a patient, but as an active participant in my recovery. And since then, Reiki has helped me sleep better, ease pain, stay emotionally grounded, and complemented the traditional medical care that I've received, not replacing it. I've also seen Reiki's impact in more serious cases. A loved one undergoing radiation for throat cancer found deep relief, less pain, more peace, even visible improvement in radiation source. It didn't cure the disease, but it absolutely improved the quality of life and supported healing on many multiple levels. Complementary modalities like Reiki, breathwork, and somatic therapies help people build inner resilience. They lower stress hormones, improve emotional well-being, thereby accelerating recovery. These are empowering, non-invasive, and affordable practices that work with conventional medicine. In fact, most practitioners actually teach their clients techniques so they can practice on their own and be an owner of their own healing journey. Unfortunately, fear and misunderstanding have led to efforts to lump these practices in with bad actors and criminal activity. That's wrong. While real threats must be addressed, they should not be used to discredit safe, time-tested, and time-tested, sometimes centuries-old healing practices. The real risk to public health is not Reiki and other complementary practices. It's denying people access to the full spectrum of healing tools available to them and the freedom to choose. That's why I urge you to support H2504 and S1481. These bills offer common sense protections that ensure safety, transparency, and freedom of choice while honoring the diverse way peoples heal. Thank you for your time and for advancing a more inclusive and compassionate vision of wellness in the Commonwealth of Massachusetts. Thank you.
Thank you for your testimony. Any questions?
Hello, good morning.
Welcome.
Vice chairs, senator, and the members of the Joint Committee. My name is Stephen O'Connor. I'm a staff attorney with the National Health Freedom Coalition and National Health Freedom Action. And National Health Freedom Action is a C4 organization that works to pass health freedom legislation. One thing I want to note is a study from Pew Research in 2016 showed that 49% of Americans use complementary and alternative healthcare options. And also, as of that time, consumers were spending about $30 billion annually out of pocket on complementary and alternative products and services. Our group, we respond year round to calls from folks and groups who want to see the right for alternative and complementary healthcare in their state. And Massachusetts citizens have reached out to us for help with this, and so that's why we're here. Now, we support H2504 and S1481 because first, they will protect consumer access to thousands of traditional, complementary, and alternative healthcare practitioners providing services to health seekers in Massachusetts. Two, it provides guidelines for non-invasive, complementary, and alternative healthcare practitioners. And so on the safety side, it requires avoiding a list of prohibited conduct such as puncturing the skin, and that's at subsection E1. Also, providers must give out disclosures regarding their qualifications and the fact that they're not licensed, and that's in subsection C. Now, as has been mentioned, 11 states have already have similar laws. The Arizona one is a bit more limited, but 11 states have had this process, and to my knowledge, there have not been substantial problems. So it's our request that these bills be passed by the committee. And also, finally, if we believe there's no or minimal fiscal impact, we think that once passed by this committee, these bills should be sent to the floor. And with that, I will say thank you very much.
Yes, do you see me now?
Yeah, welcome.
Okay, great, thank you. My name is Nate Gorman, and I work with Stephen O'Connor, who just testified. We were trying to sign up as a panel, but we weren't able to do that on the virtual, but here we are. I am the Legislative and Policy Advisor for National Health Freedom Action, and thank you once again for allowing us the opportunity to testify in support of Senate Bill 1481 and House Bill 2504. Our organization has been working with local activists for over 2 decades to help bring what we call safe harbor protections to their states. As has been mentioned, the safe harbor legislation has been passed in 11 states, including Maine, Minnesota, California, and Colorado. Complementary and alternative healing arts practitioners are dedicated to providing consumers and their clients gentle and safe wellness services. And the practices are loved in Massachusetts in no small part due to the individualized, unrushed attention that consumers desire with the wellness outcomes that they are seeking. Senate Bill 1481 and House Bill 2504 will ensure Massachusetts consumers have access and practitioners have the right to provide their gentle and safe wellness services without fear of violating broad interpretations of the practices of Practice of Medicine or Other Practices Act, such as the prohibition on puncturing the skin would address the concern of the acupuncturist person who testified. This legislation protects access to non-invasive, historically demonstrated safe wellness care. In the 11 states where various forms of safe harbor legislation has already passed, there have been no reports of public harms that resulted from adoption of the new law. This is because the wellness practices protected in safe harbor boundaries described are truly gentle and non-invasive. We also include a provision that requires practitioners who seek safe harbor protections to disclose they're not medical professionals in the legislation, which enhances existing consumer protections. Those who practice outside the clear boundaries described in Senate Bill 1481 and House Bill 2504 will still be subject to the full force of current law that protects consumers from harm. This legislation protects wellness practices without an inherent risk of harm. Practices such as Reiki, homeopathy, herbalism, traditional naturopathy, spiritual and cultural healers, and hundreds of wellness vocations that are generally regarded as safe. And National Health Freedom Action respectfully urges you to support passage of Senate Bill 1481 and House Bill 2504, and we're happy to answer any questions that you may have. Once again, reiterating that there is no fiscal impact on this and hoping that we can go straight to the floor. Thank you very much.
Thank you, Chair Driscoll and members of the committee. My name is Alexandra Renders. I am the managing director currently of a $2 billion Wall Street company. I am also an alternative healthcare practitioner providing, let's call it, multi-vibrational services to others. I particularly enjoy working with people who are in hospice, and when the nurses see me coming, they're relieved. I read this bill and feel that it's a perfect compromise. It gives good disclosure while providing what, let's call it, an opportunity and a continual service of our alternative providers in Massachusetts. I myself in 1995 was diagnosed with MS. And the neurologist said to me, I have no answers for you. And I realized I had to do something. So being a very driven person, Wall Street person, I went after my disease like it was my career. And through that, I found alternatives that led to my full and complete healing as I sit in this room today. All of my plaques were completely erased from my MRI. And that was not due to mainstream medicine, but that was due to vibrational medicine, that was due to diet, and all of the amazing alternative healthcare practitioners who have helped me through the years. I am eternally grateful to them, and that is why I'm sitting here today. 2 years ago, I sold my company. I gave up my seat as a CEO in a position that I really enjoyed. I loved leading people. I really enjoyed managing money. But now, today, I'm still involved in the company. However, my love is to take care of others and to do and to provide to others what was given to me. I cannot tell you how that has impacted my life. And I do hope for some of you that you will someday, if you have not, experience what it's like to receive a healing session from some of these amazing alternative healthcare practitioners. For me, at this stage of my life, I don't want to go and get trained and get some licensure to do something that is truly in my heart for others. And I do hope that you will consider this bill and pass it, so that these practitioners, who I will say are absolutely here for service of others, they were never one of my clients, of the thousands of clients I manage money for, because they don't do it for the money. They do it for the love, and for them to have to do any type of training, any type of licensing will hamstring them. So thank you for your consideration very much.
Thank you for your time today, and I apologize for my tardiness. My name is Madison White. I am a registered nurse, hospice nurse at MGH. I've been a nurse for over a decade, and I've been a holistic healer for just about as long. I am here in support of the Safe Harbor Bill, H2504 and 1481. I came here from MGH from a family meeting with nurses, social workers, and patients and family members alike who are all suffering burnout, anxiety, stress, and depression from a healthcare system that quite often does not meet their needs. Those needs are based on a healthcare system that is quite often based on emergency medicine and based on treating health as the absence of disease. Whereas where we have complementary and holistic measures which treat health not just as the absence of disease, but as the promotion of both mental, emotional, spiritual, and physical wellness. The amount of money that was spent for patients to try to simply just survive is astronomical. The amount of insurance that I pay as a holistic healer is $300 a year. That is less than $1 a day. And that is because the amount of harm that is inflicted in energy-based practices is so extremely low compared to many of the other practices, which quite often fall short, especially in the realm of psychological, emotional, and spiritual well-being, which we all know is a huge component of living a healthy, holistic life. I'm here to support this bill to help promote the thousands and thousands of modalities that are practiced and received by even tens, maybe hundreds more, thousands of consumers in the state of Massachusetts who are all seeking one thing: to heal, to live a better life, and to consume less pharmaceuticals, time in therapy appointments, time in rehab, time spent up late at night when they can't sleep at night. So I'm here to support these bill and to attest for many of my patients and clients who can't be here today, maybe because of their health reasons. So I ask you to please protect these services, protect the consumers who use these services, and protect the health of our people in the state of Massachusetts. Thank you.
Thank you for your testimony. Any questions? Seeing none, thank you very much.
Thank you.
So if you missed the announcement earlier, this is the conclusion of the first hearing for the Joint Committee on Public Health today. If you would like to submit written testimony, you can do so at jointcommittee.publichealth@malegislature.gov, and to my legislative director, Matt Murphy, matthew.murphy@masenate.gov. Any and all testimony received will be thoroughly reviewed and considered by the committee as we make decisions about where the bills go next.